You know, imagine a major surgery goes perfectly. The patient's on the road to recovery, everything is looking up. But then, just a few days later, the body sends out a distress signal. This is the story of what happens when a hidden threat pops up in the very place that was supposed to be healing.
So let's meet our patient. We'll call him AH. He's a 70-year-old man who just had a successful coronary artery bypass graft. The operation itself, it went off without a hitch. He's now 5 days into his recovery, and on the surface, everything seems to be going exactly to plan.
But if you look a little deeper, H's medical history tells a much more complicated story. He's been dealing with type 2 diabetes for a decade, not to mention high blood pressure and high cholesterol. His BMI is 32, which puts him in the obesity category. Now, each one of these things is kind of like a potential weak spot in his body's defenses, making his recovery just that much more fragile.
And yep, on that 5th day, the story takes a sharp turn. The calm, steady recovery, that's over. Now the medical team is staring down the first clear signs that something is seriously wrong.
The trouble is starting right there at the surgical site on his sternum. The area is getting red, it's swollen, and there's this yellowish discharge. That is a loud and clear signal of an infection. This is not just some normal post-op healing. This is an active problem, and it needs attention right now.
So the team immediately switches into detective mode. Seriously, it's like a crime scene investigation. They start gathering clues from AH's body, looking at his vitals and, most importantly, his blood work, to figure out exactly what they're up against.
Okay, first piece of evidence, his temperature. It's 38.5 degrees Celsius, that's about 101.3 Fahrenheit. He's got a fever. This is the body's most basic alarm bell, and it's ringing loud and clear, shouting that there's an invader and a fight has started.
Next, they check his white blood cell count. Now, a normal count is somewhere between 4 and 11. AH's is at 14.5. What does that mean? It means his immune system is in absolute overdrive, pumping out soldier cells to go fight this thing. The battle is on.
And the final clue comes from his C-reactive protein, or CRP level. A normal level should be less than 5 milligrams per liter. His is 85. 85! This isn't just a small problem, it's a huge sign of serious, widespread inflammation. At this point, the evidence is just overwhelming.
With all the clues pointing in the exact same direction, the team has a clear diagnosis. This is a surgical site infection, or SSI. It's an infection that's set up shop precisely where the healing is supposed to be happening, turning that place of recovery into a literal battleground. Okay, so they know what it is, and they have to act fast. But they don't yet know which specific bacteria they're fighting, so they start with a broad-spectrum antibiotic. Think of it like a shotgun blast. It's a powerful medicine that can hit lots of different common bacteria. And of course, they picked one that's safe with this penicillin allergy. All of this happens while they wait for one more critical piece of evidence from the lab, the results from the wound culture.
And then the results come in. And this is a complete game changer. It's not just any staph infection. It's methicillin-resistant Staphylococcus aureus, better known as MRSA. They aren't just fighting a run-of-the-mill bacteria anymore. They're up against a superbug.
So what's the big deal about MRSA? Well, with standard bacteria, we usually have a bunch of antibiotics that work. Treatment is more straightforward. But MRSA, it's built up a resistance to a lot of those drugs. That means treatment gets way more complicated. You need very specific, heavy-hitting antibiotics, and the risk of really serious complications just shot way up. This diagnosis just throws their initial plan right out the window. They have to pivot, and they have to do it now. The team's got to completely rethink their approach to fight this much tougher, more resilient enemy.
So here's the new battle plan. It's got 3 critical parts. First, they switch from that broad-spectrum antibiotic to one that is specifically designed to take down MRSA. Second, they implement super strict infection control protocols to make sure this bug doesn't spread. And third, they turn their focus to a hidden accomplice in all this, A's blood sugar.
See, ever since his surgery, AH's blood glucose levels have been consistently high, and now that matters more than ever. Why? Because high blood sugar actually weakens the immune system's response. It basically acts as rocket fuel for the infection. So getting his diabetes under control isn't some side project. It is absolutely central to putting out this fire.
A's story is a really powerful lesson in just how quickly things can escalate. But it also brings up a much bigger question, right? His case wasn't just a stroke of bad luck. It was this perfect storm of risk factors and a really tough bacteria. So how can we build a system to stop this from happening to begin with?
Well, the blueprint for prevention is this comprehensive three-phase approach. It starts before surgery with things like screening patients for risks, decontaminating their skin, and just getting their health as optimized as possible, like getting blood sugar under control. Then, during the operation, it's all about a sterile environment and perfect surgical technique. And finally, after surgery, it comes down to meticulous wound care, constantly monitoring for any symptoms, and continuing to manage those specific risk factors, just like AS diabetes.
Oz's journey from a totally successful surgery to a fight for his life against a superbug, it really shows us just how fragile recovery can be. It highlights the incredible detective work of modern medicine, for sure, but it also leaves us with this huge question to think about. With all of our advanced drugs and incredible technology, is it possible that the most powerful tool we have isn't the cure, but the foresight to prevent the infection from ever taking hold in the first place?